Welcome, Nathaniel Mead. It's great to see you. You are a friend of mine, so it's awesome to have you on the podcast. And one of the things that I wanted to introduce you to our listeners for is that you are a medical doctor and somebody who's worked in epidemiology, especially since the pandemic. Mario and I have been following your work closely. So, welcome. Nice to see you.
Thank you, Patrick. Just a quick correction there.
Okay.
Medical research scientist, not a medical physician per se, but I have a PhD in natural medicine, and I also so I've done a lot of research in the area of natural medicine, which is looking at what's also called integrative and functional medicine. And then looking at strategies that are involved in making medicine more effective. I
Mhm.
think you're referring to my work as, I've also done a lot of work as a medical educator, educated or lectured at medical schools, and so you're cross-referencing there. But a lot
Thanks
of
for
people do
helping me
call.
stumbling right out of the gate on your bio. Let's hope that's
Yeah, a lot of people call me Dr. Mead. And technically, that's been that way for decades. And I have worked very closely with physicians in integrated medicine clinics for many years. And
great.
most recently, in the past 5 or 6 years, have been mostly working as a research scientist.
So you're a McCullough scholar at the McCullough Foundation based in Dallas, Texas. I know that you were involved in some of the hearings in Congress, Dr. Peter McCullough, and there's sort of a cohort. I follow some of your peer-reviewed papers where, sometimes the lead researcher and other times different people are the lead on these papers. And I think one of the big papers that you worked on was called the hybrid harms um, hypothesis.
Mhm.
And is
Mhm.
that the paper that came out in the European Journal of Medicine?
Well, it's the European or European Society of Medicine.
Okay.
Um, but it's the official journal of that society, which is the Medical Research Archives.
Okay.
Yeah, that was the peer-reviewed version of that paper. We had a preprint come out that was much longer, um, like twice as long or even more than that, and that's on preprint.org. And so for people who are much more interested in like more graphics, more visuals,
Mhm.
that one has it. But yeah, that was a hypothesis that I proposed, which had to do with the interaction between the COVID infections and the COVID vaccinations,
Mhm.
because they both involve the spike protein.
Mhm.
And
Mhm.
so my thinking was that a lot of what is being attributed to the COVID infections in terms of morbidity and mortality was actually an interaction, and especially when you have a highly vaccinated population, because when you have a highly vaccinated population, the spike protein is produced for a long period of time, and so infections are superimposed on that. So that's the idea behind it, and yeah,
Okay.
it's gotten a lot of attention, and it really changes the narrative in a lot of ways for scientists because it's not an either or proposition anymore. It's always been we've been pitting the effects of the shots, the adverse effects of the shots against the adverse effects of COVID. And for example, COVID can cause myocarditis, the inflammation of the heart.
Mhm.
So you have a redundancy there with the COVID shots, the so-called vaccines, because they can also cause myocarditis. But if you previously were vaccinated and then you get the infection, you develop myocarditis, it's going to be attributed to the infection. It's not going to be attributed to the shots, even though the shots
Yeah.
probably created the initial insult and set the stage for the adverse effect with the infection. Yeah.
Well, that's great that people can find I know firsthand that you're on the cutting edge of studies that are being done. Obviously, everything that's been going on post-COVID, we're sort of in a moving set of re-understanding what really was going on. And given that this is typically an international relations podcast, maybe we can just step back and um, think about, and I'd like to ask you what COVID was in that context. I mean, even to the extreme, let's say, of whether it was some sort of bioweapon. And that then touches on, I think, some of the things we'll get on later in this interview about censorship, and at one time we weren't allowed to say the words that I just said. Um, and so, but why don't we just start there at how you personally at this point in 2026 think about what COVID was. Was it an experiment?
Yeah, boy, it's such a such a
It's
big
hard to say
question.
definitively.
Definitely was an uncontrolled experiment in the sense that we now know that the virus was leaked from a bioweapons lab in Wuhan. That was a big debate for several years. It's
Mhm.
now definitive. So essentially, it was a bioweapon. The population has been exposed to the tune of billions of people have been exposed to a bioweapon. Um, that's kind of shocking,
Mhm.
when you think about it from a public health point of view. Um, and whether it was leaked intentionally or accidentally, we don't know. It certainly was not an accident of the wet market in Wuhan. It was an accident from the lab itself, which was funded by Anthony Fauci to the tune of at least $1 million. And there was a tremendous amount of research prior to 2020 that involved the mRNA vaccines. And in fact, Moderna had a copyright on the vaccine in early 2019, which, as you know, was a year before the pandemic actually started. So Moderna was well positioned. They were, totally um, funded by largely BARDA and the Department of Defense.
Mhm.
So you have the confluence of a virus being released, a coronavirus that had been modified in the lab. Definitively, we know this, that the changes in the virus were intended to make it more transmissible and more effective as a bioweapon. I don't think people really knew the full extent of what it could do when it was released, but maybe who knows? I mean, a lot of the research was done at UNC Chapel Hill.
Mhm. Mhm.
And in fact, while I was a graduate student there, I was in the Ph.D. program at UNC Chapel Hill at the time in nutritional epidemiology. Um, and, um, you know, that research, which then got transferred to China
Mhm.
so
Mhm.
that they could complete the production of this virus, was was instrumental in the initial narrative about what this was. This was a virus that had, when I think about what happened, I think about it in two different ways, basically. I think about the virus itself and the measures that were used to respond to it. And then I think about the different phases that we went through um, in the so-called pandemic, which I think
Mhm.
is was really a plandemic because it,
Mhm.
was everybody was all the pieces were in place for responding to it in a very, very rapid fashion. And the countries were all on the same page about the strategies that were to be implemented immediately. I mean, it was like as soon as Fauci announced what the US policy was, all the other countries immediately adopted it without hesitation. including, I mean, they basically adopted a lot of what the Centers for Disease Control was saying about um, how to respond to the virus, and then once the vaccines came out, about how to talk about things like vaccination status and things like that. So all of it was almost an instantaneous kind of international adoption of narratives and policies, which is weird when you think about it. Like, how does that happen so quickly without some level of I mean, it was like overnight. It wasn't like you saw parliaments and having an assembly and discussing this, and I mean, it was just immediate. So that
Right.
suggests that the so-called COVID pandemic was that there was a lot of planning involved, and that
Mhm.
prior to the actual crisis as it was perceived or created and perceived. And then I think we also saw, um, well, basically, I'll just say that I look at the COVID event. I prefer to call it the COVID
Yeah.
event
Yeah.
rather than the pandemic in three main stages or periods. The first period was when it started. I think, officially it was in March
March, yeah.
2020, and through the end of that year and
Hmm.
into early 2021. So that's
Before the vaccine arrived.
mostly before the vaccines
Yeah.
came out, right? And so during that time, the virus did spread very quickly. We saw the lockdowns, the masking,
Yep.
other restrictions.
Eddington.
Pardon?
Oh, the film Eddington. I mean, I just feel
Oh,
like this film is a landmark because it's the only representation that has captured the weirdness. I don't know how else to put it. Just when you say masking, there's so
yeah,
much
yeah,
social ennui that people lived through, and just
yeah.
strange that there's only been this one film in a way that's dared to wade into it. But
I
sorry,
mean,
yeah,
I really believe that the masking was used to start the initial population control in a way that was not consistent with public health at all. And I remember a friend of mine came up to me in 2020. I was getting together with a group of people who refused to bend to the policy
yeah,
restrictions, and
yeah.
we called ourselves the birders. And we'd meet in a bird sanctuary, and we would
Oh,
talk
nice.
about these things, and we'd say, "Oh yeah, we're going birding,"
That's great.
and we would have these great discussions. And this guy came up to me, and he said he knew I was trained in public health, and he said, "This isn't about public health at all." And I said, "What do you mean?" And he said, "No, no, this is all about control. This is all about control." And at the time, I really couldn't accept what he was saying because I was so burdened by my own education, my own analytical way of thinking about these public health events called, infectious pandemics or whatever. And so I had a hard time accepting it, but it took me about a year before I saw what he was talking about. And one of the ways that I saw it was in the control of the scientific information. It
Hmm.
was so tightly controlled. The censorship took so many different forms. You saw scientists losing their YouTube channels, being deplatformed, demonetized,
Yeah,
losing their jobs. We saw medical doctors and nurses losing their jobs simply because they did not agree with getting the vaccine after they had already been infected. Because they'd been
yeah,
infected, they had natural immunity,
right.
right?
Yeah,
So, normally you don't do that kind of thing. You don't, first of all, you shouldn't fire doctors and nurses. That's kind of stupid because they're there to help people, you know. But secondly, they should have the right to refuse something based on their training and based on what is, essentially a judgment call. It should have been a judgment call. You know how you talk about like clinical judgment, right? Which is often used in a situation where a doctor makes a diagnosis and then they have to decide, okay, well, what's the treatment plan? And So there's a lot of intuition that goes along with the, rational way of thinking about things. And in this case, yes, you could say that because it was early on, there was a lot of speculation about what the virus could do. But in most in most cases with a respiratory virus, you're not going to see um, any kind of major fallout from somebody saying no to a vaccine,
Yeah.
and especially in a healthier population, right? So we were looking at when I started doing this research, I got really inspired. Well, first I got really ticked off, to be honest with you, because I was supposed to appear on a talk show, on a health online health show,
Mhm.
and they told me I couldn't use the word vaccine or vaccination on the show. And the show was about the immune system. It was about the immune system. And they said, you cannot use those terms on the show or we will get shut down. This is in the United States, in 2020. And I had never, ever encountered that kind of censorship before. I thought, whoa, this is really serious. If we can't do this, I mean, I could see that in China or someplace,
Yeah.
where there's
Yeah.
such incredible restriction. But to see that in the United States,
We
I knew
used to
that there
talk about
was
these issues. Sorry, yeah, like
yeah,
sorry, the things you're describing today, when we look back at that, it just sounds like the beginning of something that has been normalized. But you and
right.
I are of an age where we remember China. That's in the 2010s. The internet censorship. Using like sort of memes, and that the population has to just like as a group dodge censorship and use sort of code words in order to refer to things that are censored. All of
Right.
that, like 2020 was really the kind of arrival of that regimen.
Right. And I think that this is an important thing to mention, an important point to mention is that this is all part of the control strategy is when you use censorship in a very strategic way, you're controlling the information and you're controlling the way people are learning about something. So you're controlling mass behavior on such an incredible scale because then you get the media and social media lined up to do this. Like for example, Facebook, which we know the Biden administration unfortunately tried to heavily influence Facebook, was later sued because of it.
Mhm.
And the lawsuit was successful against the Biden administration because it was a free speech issue. And so, for example, I would go on in 2020 and 2021 when I was still on Facebook. I quit it
Mhm.
quickly after that because I saw how incredibly bizarre it was. Uh, if I posted something like, uh, you shouldn't wear a mask if, based on this published research, you know, randomized clinical trials, you should not wear a mask unless you are symptomatic. Okay. And all the trials showed that and also showed that it was complete failure on a population level for, in most cases, unless you had a really good mask. But in most cases, masking, especially with the paper masks that were used, um, or the cheap surgical masks, they didn't work at all, right? So if I stated that, then immediately what happened is a CDC warning came up on Facebook, like within seconds.
Uh-huh.
And the CDC would, the banner would say something like, the CDC does not endorse, or CDC stands by their policies, they're scientifically proven and that kind of thing. I don't know. I can't remember the exact words, but,
The
it
constant
was
warning. Yeah.
yeah, it was like a strong control measure. And then if I persisted, I got warnings and I would get kicked off Facebook. And many people did get kicked off Facebook, for posting those things. But I tried to stick with things that were published because I figured if I did that, then it was much less likely that I would get kicked off because, they can't really argue with peer review scientific literature, right?
Mm.
But going back to what I was saying about the three phases, so the first phase was before the vaccines. That was when we really start to understand that, first of all, it was an incredibly low infection fatality rate. It was only 0.2% for the whole population. So when you looked at the healthier segments of the population, it was basically zero, especially for kids. It was zero fatality rate,
Mm.
um, even in the early stages. Now, the, the exceptions would be if a kid was immune compromised, like if he had been going through chemotherapy with cancer and that kind of thing. Um, and then if people were heavy smokers or heavy drinkers, or if their immune systems had been exposed to drugs that suppress them, yes, they were more at risk of the adverse effects. So that's what we learned in 2020. Going into 2021, we had the vaccines. That was the second phase. And in 2021, um, we saw around the world, once the vaccines were released, we saw the excess mortality rates go way up in all the countries. Now, the public health experts like Fauci and some of the others who were the experts were all saying, "Oh, well, this is just because the virus is now mutated. It's in a more aggressive form, and it's spread to more people, and people are relaxing their masking and their social distancing, so it's killing more people." That's what they were saying. The hybrid harms hypothesis, which I mentioned in the beginning, you mentioned, and I clarified what it's about. That's kind of what was happening, I think, in 2021, is that you had all these people who were being exposed to the virus and were getting the shots, and I think that was a big reason that that we saw the mortality go up. And then the third phase was really when the infection, the official end of the pandemic was in May of 2023.
Okay.
Okay. That was the official end. And that's when the World Health Organization announced that it was over. And what's really interesting is that excess mortality has continued at a fairly strong clip in the most vaccinated countries. When you look at the countries that had the lowest vaccination rates, and I'm about to publish a paper on this, um, you saw that the that had the lowest rates had the lowest excess mortality. What excess mortality means is we're talking about all causes. So death from any cause, which is important because if you talk about COVID mortality, it's much more debatable, and there's a lot of ways to obscure what's actually going on
Hmm.
or to distort the true picture. But with excess all-cause mortality, it's a number that's not very debatable, because you can easily show total mortality for a population. So when you look at what excess mortality, you're using a baseline, in this case 2015 to 2019,
Yeah.
okay, just prior to the pandemic.
Yeah.
Then you've got the pandemic or COVID era, and then what's happening during that time is being compared to the baseline. And so the excess mortality is either a percentage, or there's other ways of calculating it that we'll talk about in our paper. But so in the third phase of what we're talking about, the COVID era, we're talking about after the threat of the viral infections had pretty much subsided. Now, the real kicker for most people that they don't realize that the threat had already ended as of uh, early 2022, when COVID became Omicron,
Right.
because Omicron was a
Wild.
very mild variant. Yeah. And you and I have talked about this. And so,
Yeah,
you
but I
know,
have I have the post-COVID brain fog, so I don't remember that conversation.
that's why you're being so slow to respond. But
Yeah,
yeah,
yeah.
but
Maybe there's a
no,
delay in the feed. I don't know.
well, you're the interview here, Patrick. But yeah, so it's I mean, there is the reality of long COVID, but many of the long COVID situations um, were superimposed again on this heavily vaccinated population, and so you have the interaction between the vaccines causing similar to what COVID was causing when it was aggressive early on, which was not just the respiratory problems, but also autoimmune, cardiovascular, and neurological problems.
So you're
Neurological,
describing the combination of vaccination and infection and
not necessarily, not necessarily.
okay.
You can see in people like older adults in particular, and people who had cardiovascular disease or obesity or diabetes, they were prone to more autoimmune cardiovascular and neurological problems if they got COVID before the vaccines. Okay. So this is why it is tricky because, again, the virus itself involves a spike protein. The spike attaches to the cell and is part of what stimulates the immune system. But the spike protein is also what's generated in massive amounts by the vaccines and in a much more long-term fashion. So many of the so-called long COVID situations were that combination, as you just mentioned. So yes, autoimmune, cardiovascular, and neurological problems linked with so-called long COVID were also actually due to the vaccine. This is not speculation. This has been demonstrated in really good research where you can actually show the presence of the mRNA from the shots being associated with long COVID, even though that long COVID was attributed to the virus, to the viral infection. By the way, some other things that predispose people to all these other problems is smoking, heavy drinking. Um, those things can weaken the immune system, especially the drinking. And so, we knew this back in 2020 with the virus, but as things progressed, what was happening, and this was really, really important for me because the light bulb for me when I thought about the hybrid harms hypothesis was I was looking at these waves of COVID in 2021, 2022 and 2023, but especially in 2022. Okay, this is a very important
Mhm.
year. Probably the most important year of the pandemic is 2022 because by that time Omicron was dominant, but yet we were seeing these waves of COVID that were being associated with waves of all-cause mortality. Okay. Usually with COVID, you would see with a milder variant, which was Omicron, you would just see respiratory related mortality if
Okay.
there was, and that would be for really older people, right? But we were seeing all cause mortality with these waves. And what was being reported, which was really kind of wild, and it was mostly these Chinese researchers, and I had to believe that they had some gun at their head because they were saying that that it was still being caused by COVID, right? But the populations that they were reporting on were the most heavily vaccinated populations in the world. And so, like Australia, South Korea, Singapore, Taiwan, and these populations the Asian populations are so much into conformity that a lot of people just went on along with it, and the governments tend to be more authoritarian. So they kind of pushed it on the people, and those people unfortunately suffered from this. But the official narrative was, look, Omicron is killing all these people. You got to keep the vaccines going, or this is getting out of control, right? This is what the scientists are reporting. And when
That
I
the
saw
that
that, I said,
the
that
the
is
ex
just so messed up. I said that can't be right. That can't be right. So I looked into it, and that's how the hybrid harms hypothesis got birthed. Because I realized that no, what they were talking about was the interaction between the two, and so the reason I said 2022 is the most important year
Mhm.
is that in 2022 we see the most striking um, what's called concordance, meaning the alignment between the cumulative vaccine doses and the excess mortality increasing. Okay, so there's an alignment, and you can show this, that there is a agreement between those two trends, the increasing vaccination rate and the increasing excess mortality in these various countries. And I looked at 35 highly developed countries, and we've now demonstrated this. And the major year that shows this is 2022. In 2023, it's still highly significant. We're talking about very high level statistical significance. 2024, still significant. 2024.
Mhm.
Now,
Mhm.
that's based on this is important for people to keep in mind, though, if when I'm saying this, and then we'll get into some politics. But basically, what we're talking about is cumulative doses as of January 2023.
Okay.
Okay. So you're accumulating up to that point. You measure the cumulative doses for all these countries, companies as of January 2023, and then you can see that it's correlated with this significant concordance correlation 2022, 23, and 24. Now, of course, by that time, the threat of the pandemic was gone, and we're talking 35 countries. And so this is a very important realization that, yes, a lot of people did die. People will point out, wait a second, didn't a lot of people die in 2020? Well, yeah, a lot of people died in 2020. There was actually worldwide, there was, I think it was 11% more deaths
Wow.
across the whole world. Okay, all cause mortality, right?
That's a lot.
Now that's very important to point out. Okay, so but some places like Asia and Africa showed much lower rates. Okay, which is kind of interesting, and there's a lot of speculation as to why that is. But I think that when you look at um, the real reasons that people started to um, die in large numbers in early in 2020 in the first phase, the real reason was that um, people were not getting treated properly,
Mhm.
and even today you'll still meet people who will tell you, oh, ivermectin and hydroxychloroquine were totally useless, right? And there are a lot of, especially people on the left,
Mhm.
who believe this. And the
They
reason,
were deeply stigmatized. I mean, th those two treatments specifically became kind of memes for the stupids, the horse tranquilizer, or these were sort of like toss away terms for um, just writing
right?
off.
Yeah, and a lot of the reason that people believe that is because um, I mean, regulatory capture, which is what RFK Jr. has talked about a lot, and that was his main thing, even well before the pandemic. He was talking about regulatory capture. Um, that notion was largely an abstraction before the pandemic. But once the COVID era started, we started to hear this term a lot more, and so what most people don't realize is that those early treatment options, ivermectin, hydroxychloroquine, both of which are anti-parasitic drugs that have been extremely well studied. I mean, hydroxychloroquine was used during the Vietnam War, administered to like 1 million guys during the Vietnam War.
Are they both
Uh,
anti-malarial? I thought that ivermectin
uh,
was used to
I
treat
think
malaria.
that, yeah, I think the hydroxychloroquine certainly is. I think the ivermectin is more broad. It can be used for other parasites.
Okay.
But the point is that they were well studied. We knew what the pharmacokinetics were. Um, Same thing with the antidepressant fluvoxamine, which was a SSRI inhibitor, and that too was shown to be an effective early treatment. But people don't realize that those treatments, the reason that they got so
Mm,
blacklisted
mm,
officially and even, by the media, and people were brainwashed to believe that they were ineffective. Population had to be programmed to believe that they were ineffective because legally the government could not push the emergency use authorization, the EUA, if those treatments had been proven effective. And so that's why we actually saw studies coming out, studies being conducted by the vaccine enterprise. And the only way you could find this out is you look at the conflicts of interest statement for the authors, or you had to look at the funding sources for the studies. And you'd find out that the vaccine industry was behind this. They were intentionally designing these studies to make the early treatments look weak and useless. Okay. And so they were also the government, the CDC and the FDA
mm,
were imposing these incredibly stringent evidentiary standards, standards for proving that these things were either effective or ineffective. So these were incredibly unprecedented standards that they're imposing on the researchers. And then there were all of these negative publicity campaigns that the pharmaceutical industry was putting out constantly. And at the same time, they were promoting things like remdesivir. Do you remember
mm.
remdesivir?
I remember hearing that, but I've forgotten what that was.
Okay, so remdesivir is a very interesting one because it was being used to treat COVID at advanced stages. All
Mm,
right. But remdesivir, when you looked at the actual data, it had very minimal benefit at all. And yet it was extremely costly.
mm,
And it received preferential treatment in all the US hospitals. But listen to this remdesivir, and we wrote about this in one of my big myocarditis papers. That was the one that got featured at the US Senate hearing that you mentioned. It was the US Senate hearing on the corruption of science and federal health agencies. I think that's what it was called. Um, so it was a very interesting Senate hearing. Um, and remdesivir had cardiotoxic effects, meaning it was toxic to the heart. So,
mm,
um, here's an interesting thing that an example of how things got so distorted, and in a way, you're talking about almost like sometimes I would think this is like an alien intelligence, to orchestrate this because it's kind of wild how this comes together. So here you have a cardiotoxic drug, remdesivir, being recommended to
mm,
COVID patients who have been told not to get early treatments.
mm,
Okay.
mm,
Don't get early treatments, ivermectin, hydroxychloroquine. They don't work. Don't use them, right? Complete BS. But then they were told, don't come to the hospital until you're very sick. Okay. That was a standard recommendation because we don't want to overrun the hospitals.
yeah.
Okay. So they would come to the hospital very sick. Then they'd often get remdesivir or they get put on, oxygen prematurely. And the remdesivir is often ineffective, or it's having these cardiotoxic effects. And if you were then vaccinated, as many people were in 2021, the cardiotoxic effects of the remdesivir were interacting with the effects of the vaccine, and people were getting more heart problems, especially myocarditis, which was documented by the CDC as a major signal in, I think it was early 2021. So it was already known that the vaccines were causing this, but what people were not being told is that the remdesivir was making it even worse if they later, if they got COVID and went to the hospital. And so people were dying in higher numbers because of heart damage. And guess what? What was it being blamed on? It was being blamed on the virus, on the viral infection,
Well, and
right?
that's maybe where we get into some of the politics more. Also, the blame was often on the unvaccinated, and I think as steeped in the research as you are, and I imagine some people may struggle to follow some of what you'd laid out,
Yeah,
but
yeah,
you're going up against. There's a first wall of kind of just received information. And you described kind of the first person who asked you, is this against public health? You and Mario were both people who, for me, after going with the program for about a year, I started to kind of step back and question. And I guess, that's just something that we're all at different points of. Trying to understand this. So, it's deep what you just laid out, but I think maybe we can step back a little bit more into some of the narrative issues. You said a lot of really interesting things for a layperson like me, who obviously I'm not a researcher of epidemics by any means. One interesting thing I wondered if we could get into a little bit is the prehistory of COVID. When we're talking about 2019 and
mm,
what was kind of in place. Obviously, the research that we didn't know about that were going on in labs is part of this, but then there's a social aspect to
mm.
this that I've found fascinating. And I happen to teach, I don't know if you know Thomas Faisy's book, The COVID Consensus. There's several books that came out quite early that were just, Giorgio Agamben is a well-known kind of social critic from Italy who made a big splash by questioning things, and early on was written off, and so these kind of contrarian takes on the pandemic, people have obviously gone back to and reconsidered in some ways. But yeah, I was thinking about something that you and I have talked about over recent years, that social distancing seemed to be something that you can look at from a certain angle, as people were primed for social distancing, so that when March 2022 arrived and the kind of the shutters were drawn, um, one of the factors, excuse me, that I observed was, the culture war around Trump, and the sense that this was sort of a mad president, but especially even more than the political figure himself was the voters, his supporters. That these were the people who quickly were turned into anti-maskers, anti-vaxxers. I mean, obviously, it wasn't a total alignment, but I'm sort of speaking in terms of narrative because. Another
Yeah.
book that I found very powerful about this was a pretty mainstream economic study by Angus Deaton and Annie Case, I think, called the it was Deaths of Despair, and they looked at different kind of social divisions around 2020 that had developed.
Yeah.
The carceral diploma divide, the coastal elites versus the flyover zones.
Well, yeah, I mean,
Yeah.
one of the, I don't know if you and I talked about this before, but, you had identity politics, Black Lives Matter, the Me Too movement. When the Me Too movement came into full force between 2010 and 2018,
Yeah.
in that period of time, um, what was going on, I remember there was a discussion on the Senate floor about no longer even shaking hands because men were so terrified of being cast as predatory or, you're trying to seduce this woman by shaking her hand, by touching any kind of touch. And and so that was a kind of interesting preamble, I think, to this whole event, because you had people who were afraid of touching each other, and especially men um, were being, I mean, they were being lined up, and some of it was justified, but I think a lot of it was uh, sort of a lot of unprocessed rage and judgment toward men from years and years of women being abused and being subjugated and being um, mistreated by men, which is, understandable. But then you start to create an identity politics around it, and you are setting people up for physical distancing,
Yeah.
what was called social distancing, which is a euphemism really, because it wasn't necessarily, it was just physical distancing. You were separating people's bodies in physical space. Um, and so, that whole thing, and then that bled over into,
Hmm.
I mean, it was really bizarre where I was in Chapel Hill, North Carolina, because that's kind of like an island of liberalism at a very high level. Um, I later started calling it libtardism, but because it was so bizarre, people would be wearing masks alone on a Zoom call,
Yeah.
or wearing masks alone in their car while they were driving, or wearing masks alone sitting in the park when there's nobody around them out on a beautiful sunny day. Well, what are they doing? Well, what they're doing is they're virtue signaling. They're trying to show people, look how great I am for wearing a mask, but I'm all alone. There's nobody, close to me. There's nobody who's getting affected by me. It's all a symbol. What is a symbol of? Symbol of conformity, symbol of blind obedience. And then you get the physical distancing laid on top of it. And all of this segued perfectly into the vaccination campaign because people are like, oh, we're already doing this great thing for everyone else because we're masking. So I'm protecting, grandma, physical distancing. Uh,
Right. It's a elevation of virtue of education. When
yeah.
to have this is sort of an internet slur, like the libtard, but it's when it cuts against the grain of something that for for a certain part of the population is just a kind of given that if you go to higher education, especially these sort of putting others before yourself in the way that yeah, obviously the mask captured, but again, as sort of priming, it's interesting as you're talking, I'm realizing that, you had this sort of first confrontation of this dynamic in 2016 with Hillary Clinton's comment about the
Oh,
deplorables.
oh, right.
And
Right.
but then it's, 4 years later, it's like Trump has created a certain amount of bad blood, and he seemed inept in some ways to handle if there is a pandemic coming, and so there was sort of this swing towards the Democrats as the really, especially in that moment, the embodiment of this kind of tech friendly, well educated. There's obviously a sort of wealth. If you have a certain amount of wealth, you're equipped with that education and sort of moral halo. If I'm not describing it as well
Hmm.
as I'd like to.
Hmm.
Can you? I
Hmm.
mean, maybe can you take that into what you're saying? Is there? What am I missing with that description?
Well, I mean, no, I think what comes to mind as I'm listening to you is I'm thinking about the way certain words were charged early on. Even, And I think social media amplified the emotional charge of these words, like social distancing and masking. But then there were other words that got enveloped or, under some kind of common lexicon among people who were in the know,
Yeah, yeah.
in this sort of very, very righteous kind of liberal mindset.
Hmm.
And if you weren't with us, you were against us.
Yeah,
I think the social distancing did create a kind of us versus them. It amplified that polarization and that division, and that
yeah.
really created. It opened the doors for a lot of you call it priming. I call it programming.
Hmm.
Priming is a great word because you're right. It was setting the stage
Hmm.
for people to be programmed and to be in lockstep. Um, but the word that I really, was shocked about was, and it, again, the turning point for me was that online talk show that I was on. The word was natural immunity. Natural immunity. I'm just going to say this because it still to this day is so shocking to me that these terms that were neutral scientific terms
Yeah,
you can find them in any medical textbook. Natural immunity was dismissed in policy statements
hmm,
by the Biden administration, and and probably um, you know very strategically because it, natural immunity had to be ridiculed in order for vaccine induced immunity to gain prominence.
yeah, yeah,
And so those who espoused natural immunity as a fundamental aspect of physiology were demonized.
yeah.
They were
Beyond
they
the
were
pale.
demonized.
Yeah,
And,
yeah.
and
It's
I can tell you, this is important for your listeners to know. And if I had the graphs in front of me, I'd show them.
uh,
But the Cleveland Clinic, which is one of the most esteemed institutions in the United States for medical research, they put out several major studies of over 50,000 people per study, where they showed that the more vaccinations people got compared to natural immunity, which is no vaccination, okay, you saw a graph where you saw increasing COVID infections in a linear fashion. The slope kept going up and up and up
yeah,
with more vaccinations.
yeah,
So with no vaccination, which is just natural immunity, COVID infection results in it's infection induced immunity. But natural immunity also includes even prior to infection. If you're relatively healthy, if you're playing basketball, you and I love basketball, so I had to mention that.
Oh
In fact,
yeah.
we played against each other.
We're gonna get a shout out to your incredible interview with all-time assists NBA leader John Stockton, where
Got to
you get
mention
into a lot more,
Got to
of
mention
the.
that. Got to mention it. But there's immunity that exists even before you get exposed to the infection that has to do with just your fitness level, your nutrition, your handling stress and things like that. And all of
That's
that
health.
creates a baseline for being able to defend yourself against infections. It's really important that people understand that. So what was happening was, the population was being given these messages over and over again to convince them that natural immunity was not an option in this. And in fact, it was. It was, and it's well shown, well demonstrated that it was a very effective option, for the population.
It's fascinating how you're describing that in the context when you mention Me Too. I see some alignment there about that.
Mm.
Those who are broken off for actually being informed, or having if you have a kind of medical background, you might discover something that puts you in this beyond the pale category. And I thought that was very interesting how you described the 2010s and this period where I was involved in the Occupy movement, in 2009, and I know you also are coming from the left, but
Yep.
then there's this thing that happens that we're talking around where this liberal consensus. I think 2009 to me, interestingly, was a moment in which the mainstream bourgeois uh, faction in the U.S. actually did look left. I mean, I think that's really what um, Occupy was, is that those were anarchist and far left tactics that were actually embraced by the mainstream because there was so much dissatisfaction with the handling of the financial crisis. But then, what ensues is some kind of like reaction against that. And I thought you described that in an interesting way that you could, I don't know, it's like yeah, that's just interesting, kind of this well, it's been something that, many of us have lived through that those conversations have broken down and it's like you're talking to somebody from outer space or really this whole discourse, attempting to kind of prevail on people with information and rationality, but coming up against a sort of like, you're in that camp, and then something that I know we both come from these large, generally liberal families where you have these conversations of things like being against the war, for example, or that Trump built his career on for about a decade. Glenn Greenwald recently articulated this in a really interesting way that this guy really built his political message on ending forever wars. That was like his calling card. And of course, we're about 2 months now after this, I think, really epochal disaster of starting this war in Iran. But that was something that created a lot of dissatisfaction in Biden land, and attempting to kind of criticize that formation from the left you essentially just with Trump. That was sort of how we were seen by some people and family members, and that it kind of came to that if you were questioning some of these things, you were essentially lumped. You said, if you're not with us, you're against us, that kind of formation. And
Yeah.
so I wonder if we want to
Yeah.
wrap it up there, and then maybe we'll do like a part two just for subscribers or something like that. But do you want to
That'd be great.
respond? Yeah, do you want to respond to that point?
Yeah, I mean, there's a lot to unpack there, but I think you're right. I think there has been a lot of disillusionment with administrations that has to do with them going against their original, you know, claimed agenda, um,
Yeah,
official agenda, and the official agenda is often. I think we're I believe personally that people like Trump, as much as he would appear to be on his own, because he is unlike any other politician in that he will go on Joe Rogan unscripted for 4 hours, or he will do things completely unscripted, which is sort of the opposite of Kamala Harris,
right.
who was always scripted, and I think that turned a lot of people off. And then the fact
Yeah,
that Trump. So what you think you're getting with Trump is um, paradoxically an honest
yeah.
person.
Someone like you.
well,
That's
well,
sometimes.
but I didn't think that back in 2016. I thought Trump was a pathological liar, and
Yeah.
I thought because I was heavily programmed also at that time, and I wasn't listening to what he was saying. I was simply ridiculing him at every step.
Mhm.
And so a lot of times when you're predisposed to, like, Tucker Carlson has been the same way for me. Now I listen to Tucker Carlson and I'm going, whoa, that guy's really sensible, and he's really got, but I used to be in the camp of like, oh, he's from Fox News. Fox News is completely,
Well, he'll
right.
even say that about himself in some ways.
Yeah,
I mean,
yeah,
he has traveled
yeah,
to an
yeah,
interesting
yeah.
place.
But basically, just to conclude what you're saying, I agree. I think it is shocking, but I think that what we're starting to see is that there are much bigger forces at work here than anyone really understands. I think Trump is being manipulated, and I think a lot of other politicians are being manipulated who are very, very high level, and it's for by means and reasons that we don't really understand.
Yeah. Yeah.
And that's all I can say at this point.
I thought we got
Um,
into something really interesting that, I'm always wanting to get to, and it's quite difficult, but I think in some ways we pierced that memory bubble. It's difficult to return to 2020 and 2019 and, access sort of the things people were feeling and the pressures that
yeah.
were being pushed into. I just remember that shuttering of doors in March of 2020 that, people were sort of ready to go indoors, ready to go online. And the Bernie campaign was sort of at its high point, but also already tapering off. And this figure who had captured so much popular energy, in some ways uniquely because of his message on healthcare. And one of the really powerful moments of that I recall was he accessed a kind of unique political technique of giving the mic back to people. He was having these rallies on different topics. I think one of them might have been around veterans, but there was
Mhm.
one about like healthcare where people were telling kind of their horror stories or disabilities, like losing loved ones. And that was creating a kind of social thing of like not hearing the candidate, but hearing just other Americans, I guess you'd say, sharing. And so I think he was tapping into something that then afterwards it looked like he wasn't the man who was able to really like kind of be at the helm of what he had
Mhm.
accessed. And in some ways that are, I think, still for people like us probably like difficult to admit, Trump proved much more able to, ride a popular crest than Bernie would have. And
Mhm.
I'm not
Yeah,
thrilled at all with where things are going, but I
me
think
neither.
you have to sort of be honest with like, what was he able to do also in 2024? You just spoke to some of that. I heard someone say,
Mhm.
I found it very insightful that he doesn't speak down to people. He never pretends to sort of be smarter than the people
Mhm.
he's talking to. And I thought, oh my God, that kind of says so much about this whole social phenomenon of the deplorables, and that there's just this constant speaking down to, and the ostracism that people live in so many ways, and why you would have popularity behind somebody who seems to have come around and be speaking for those who have kind of just been
I
discarded by the system.
completely agree. I completely agree. I think that's been one of the main draws. And then when he brought in RFK Jr. and brought in Tulsi Gabbard, those people also speak very much from the heart, you know.
I will
And
say something totally, and then also Cash Patel. I mean, I know it just sounds
oh,
so
Cash
absurd
Patel.
now, but in
Hmm.
2024, those three,
Hmm. Hmm.
Cash Patel had
Yeah.
been making his career on this sort of Epstein file stuff. So
Wow.
probably, like you're saying
Wow.
about who's being controlled. But yeah, it seemed like there was a coalition there, and it's kind of amazing that here we are in April of 2026, and Tulsi and RFK are still in the admin. They might not be soon. It looks pretty sketchy, probably for both of them.
They're both being very cautious, I think. Tulsi definitely seems that she's in lockstep with the administration, which is it doesn't seem like Tulsi anymore. But
Right.
I think you're right. I think they're being extremely careful, especially Tulsi. I think RFK is sort of in a place where he's still holding his own and he's still doing amazing things. And you and I have not talked about Maha, but let's do it. Do you want to wrap this up for now and then we'll come back?
Sorry, I know I'm just going to, it got a little chilly here. I've got the window open.
Okay.
But I think it's a great conversation. And like I said, I'd like to just talk to you a little longer if you have some time. And
Sure.
on the Patreon, I'm going to have this for subscribers only.
Okay.
Um,
Okay.
yeah, I mean, anything you want to say about Maha? I think we're in a good point of the conversation to kind of
Mhm. Mhm.
touch on that because it's in a way, um, I think what Tulsi and RFK, the explanation that anyone who's followed them would give is it's sort of like, they're making these absurd sacrifices, even where like Trump seems to intentionally try to humiliate each of them in a way, but then the idea is that there's some transaction and that RFK was going to be allowed to pursue a certain policy agenda if he sort of made these, like bowing to Israel or something would be part of the trade-off.
Mhm. Mhm. Yeah. Well, yeah. So, I mean, if we want to launch into Maha, which I'm perfectly um, good with doing right now, um, what I would say, I want to go back to this notion of regulatory capture because uh, in the beginning, when I first heard about it, and I had the incredible honor of talking directly with RFK Jr. In 2023. I think it was in April of 2023, and I spoke with him on the phone for 33 minutes, and I recorded it. And we talked about regulatory capture, and the intention at the time was he was considering possibly using me as a writer for some of his enterprise, um, and so I was really impressed with I've always been incredibly impressed with him as an intellect, as somebody who loved that picture of Einstein.
That's
Uh,
actually Nicanor Para. Yeah, that's my
oh,
little.
sorry,
Yeah,
I
sorry,
couldn't
I got
tell because he
stuck
had
in
his
my.
hand over his face.
I know. Yeah.
Okay, but uh, the regulatory capture was something that he really drove home in our discussion. It wasn't just an abstraction during the COVID era. FDA committees were routinely including members of the industry on their committees. And senior officials within the government were rotating into out of government into lucrative pharmaceutical industry positions
Yeah.
and back and forth. And so this was not just any kind of mere partnership. It was really a suspension of normal regulatory behavior and policies, normal market rules also. I mean, blatant conflicts of interest, right? And and it was also a suspension of scientific the normal scientific checks um, in favor of speed, and like, you think back to Operation Warp Speed, right? That Trump coined, or somebody coined under Trump. And it was all about making things happen fast, right? And so there was a kind of um, monopoly on the the regulatory process that was heavily influenced by corporate the corporate profit motive. And so we saw record corporate profits during that time. Um, we saw many billionaires created during that time. And um, and of course, once a lot of this started coming to light, and I was initially thinking that you and I would talk a lot about some of the financial aspects that drove this. But we can come back to that at some point. I'd like to go into Maha, but it is shocking to look back on some of the financial. ways that the COVID process unfolded. Um, and so there was a kind of policy uh, monoculture that treated any kind of dissent as misinformation. And so you saw people being accused of being conspiracy theorists and misinformation spreaders and all of
Right.
that
Right.
in order to keep this whole thing moving forward. This massive uh, um, kind of monoculture, policy monoculture is the term that I keep thinking of because it's how they could keep these policies in place. And I think Maha was wildly successful coming out of the gate because of that, because people recognize that, this is just not right.
Right.
We shouldn't have uh, the pharmaceutical industry, the most powerful industry on earth, controlling everything, controlling the messaging, controlling policy.
And it totally
So,
cuts across parties, and you have to contort yourself wildly. The Democrats went from this sort of more working class party to just complete betrothal with the if you can say that, being betrothed to big pharma. And it's still unresolved, I think, just the hunger out there for natural medicine, for clean food. Um,
yes,
and
yes.
so, yeah, you can easily see how a coalition, kind of populism, could function around that issue.
Well, yeah, and also when you think of the words "make America healthy again," it's so much better than the chest thumping "make America great again," right? Like it takes it out of ego and into like well-being and quality, like, oh, we want the quality of life to be better. We want the quality of our neighborhood gatherings and communities as a whole. We want them to be healthier, right? So Maha, the Maha movement, the thing that really struck me right from the beginning is you could tell that it went way beyond politics because
Mhm.
it resonated with people who were getting disillusioned and saddened by the fact that their communities were falling apart, or they were seeing a lot of unhealthy people. They were encountering a lot of mental health problems in the world, and especially in the United States, where we have such a unfortunately very unhealthy population.
That's just
And
what politics are. I mean, sometimes this word invariance is used, but it's just like that just simply is what people want.
yeah,
And
yeah,
yet what we've already talked about today is the ways in which Maha is a stigmatized term, or that, the association with Trump and MAGA, the scientific matrix in which these are dangerous, drinking raw milk, not anti-vaxxation. So there's this way in which the simple kind of claim to health, which would be basically universal, can be, inverted to where, I mean, and of course, Maha is a political project where, I wouldn't just say like, oh no, that is contiguous with just like 100% what people
yeah,
want.
yeah,
But
yeah.
yeah.
Well, yeah, but it really has its roots in the medical freedom movement. So it also has a lot to do, I think partly why it resonated so strongly was medical freedom was seriously infringed upon
Mhm.
throughout the COVID era. So you saw this desire for medical freedom to become much more of a primary focus within the government. And I think RFK recognized that, and it was part of his brilliance to make Maha a central focus. And I'm grateful that he has been able to do it. And some of his accomplishments, I mean, it's really, really striking. Um, but I think like just focusing on the food supply, focusing on additives, on the food colorings that have affected children's health for a long time
Yeah.
adversely. Lots of behavioral problems.
Yeah.
Um, Glyphosate, which is part of Roundup. They're trying to address that. That's a really incredibly important one.
Well, isn't that
Um,
the one that you could say was sort of one of Trump's humiliation attempts, where that's a big part of RFK's career with lawsuits prior to joining the administration? Then Trump passed, it was like national security that the glyphosates will remain in the food supply.
yeah, that one is baffling to me, Patrick. I'm smiling because I don't know what to make of that. It's so bizarre.
Can you name what do you think is the most important? Is there a single kind of achievement up to this point? And I also just wanted to shout out Prasad at FDA, who was also seen as actually sort of like a Bernie Sanders-like appointment at first. Some of the controversy around even getting him in that position. But yeah, what do you think are the high points of what they've done in this first half of the administration?
Well, I mean, there are so many, they're trying to get nutrition as a more prominent part of medical training, so doctors are going to be taught much more about nutrition in the medical education setting, which I think is really, really important. He one of the things early on that got me was he ordered the CDC to stop recommending water fluoridation
Hmm.
in communities. Fluoride is sodium fluoride, which is rat poison. Okay, it's been added to the water supply for decades, and it does have some ability to help with calcium metabolism, but that's a poor excuse for using it when it also is a toxin. So he initiated a new EPA task force to review fluoride's health risk benefit profile, and then to start getting states to start getting it out of their water supplies. And some states have done this. Um, he also, I saw a report that he spearheaded on pesticides and effects on children's health and cancer risks. Um, to see, I don't remember a single HHS secretary ever doing anything meaningful at all. And yet you've got this long list of things, the fluoride, key one, pesticides and children's health. I mentioned the artificial food colorings,
Yeah, yeah, definitely. It's
which
a big one.
I mean, it's just common sense, right? People are like, well, of course you get those out, but I mean, he phased those out of certain colorings that had been shown to be very harmful, for a long time, and most of his attention, as you know, because he started Children's Health Defense, most of his attention has been on targeting childhood chronic diseases, um, environmental pollutants, of course, the vaccines, the overprescribing of certain medications. And then there's ultra processed foods. He's talked about that a lot. He's talked about junk food and getting junk food recently. You and I were talking before the show about how he's getting junk foods out of
The military.
the military, and he's talking about getting him out of hospitals as well, which would be amazing because think of how many people are
Hospitals.
in the hospital setting eating junk food and they're really sick, and that's not helping matters. It's probably making it a lot worse. And as far as the military goes, it's interesting because it could lead to a lot of improvement in the physical and mental health of people in the military, which is a real plus. So,
Yeah,
um,
there's another aspect to this that I think is interesting.
yeah,
That's
yeah.
the food production and its relationship to immigration. This regimen
Yes.
in this country for decades and decades that was another one of these. populist issues, and I sometimes have to just articulate this slightly to for people to understand that there was widespread support for immigration reform, and much of that was from immigrant communities. And it's such a it's become a wedge issue to really break people apart. But
Hmm,
I think the
hmm,
way to articulate it is that. Um,
hmm.
we have a permanent or a semi-permanent second-class citizenry, most especially in the restaurants and the crop fields, and this is often termed the agro-food industry. Um, and so, immigration reform would be we don't want to perpetuate this social feature that there's just a major faction of the labor force that drags everyone else down. Also, that's one justification for changing it, and the fact that it's simply unjust for those who make the food to not have legal protections. And
Yeah,
so, when we're talking about, where these regulatory captures come from, these people are just hiding out, the big business that perpetuates this system, and they don't step forward and show their faces and pontificate openly of why they want these policies. They do it entirely behind the scenes.
yeah. And
But yes, yeah,
RFK Jr., has been fighting against that for decades, against that corruption and the mechanisms that enable that corruption, to continue. So that's one of the reasons why I was so excited to see him run for president initially. And you know, another major accomplishment that I forgot to mention is he actually played a very central role in the U.S. decision to withdraw from the World Health Organization. Now, that a lot of people are going to say, well, why is that a good thing? Well, the WHO, first of all, it's heavily controlled by Bill Gates and the Gates Foundation. Bill Gates gives them tens of millions of dollars every year, and he controls a lot of their agenda. Um, and so the pharmaceutical industry has incredibly close ties to the WHO and can mold a lot of their decisions. And during the COVID era, the WHO, we really saw its true colors where it was trying to push um, certain policies like, you know, setting up emergency pandemic policies where they could control basically all decisions around how those pandemics were dealt with, in other countries. So anyway, this is a very important point, and getting the United States free of that bond is actually extremely important.
yeah,
And so RFK, pushed that because he saw the corruption. He saw this is very high level regulatory capture,
yeah,
of the
yeah,
WHO.
yeah,
Uh,
yeah.
but I'm sorry, I didn't mean to. I just wanted to mention that. I didn't mean to segue too much away from the immigration issue. It's just I don't know much about that,
That's
so I couldn't
fine.
really
I
comment on
think
it. So
no, I know, and just maybe it's
yeah,
kind of a closing point, but because
yeah.
actually my family just
Ah,
walked in, so in a minute I
okay,
should probably
okay,
wrap. But it just
yeah,
because we actually ended our last interview on the scholar of the Iraq War, Brandon Wolf Honeycutt. You kind of coming back to this question of a New Deal in the wreckage. When we're looking around at just how dark things look right now. And Brandon and another guest, we're going to be talking about the Iranian Revolution and what was going on that allowed for that event, that these moments in history can kind of appear sort of surprisingly. But you think about 1932 and just how dark of a moment that was in the Hoover administration, and a lot of working class organization really forcing this compromise candidate to create programs like the WPA and Actually,
Yes.
you have some background in New Hampshire. You'll catch the reference. I mentioned that this whole idea for me was sparked by being in Tamworth, New Hampshire, which had a WPA dairy farm program, and just you can still see the amazing kind of cultural remnants of these programs, like something so simple, this desire for clean food and like there's a country doctor in town people can go to still in 2026. So, it's just interesting how these issues intersect. And I thought it was really enlightening to kind of bring your health focus into this, where we're often looking at war and international relations, and maybe in some of that combination is where we can get some of this sort of surprising breakthroughs, touching on some of these.
Yeah, I just want to end on a really important point, sort of a nice segue from what you're talking about. And that is the Maha, does have a shadow. Everything has a shadow, right? And the Maha movement still has not succeeded in getting these modified synthetic mRNA so-called vaccines, which are actually gene therapy products or gene transfer products, um, still hasn't gotten them banned or removed from the market to this day. Now, RFK has managed to get them off the childhood vaccine schedule, which is very important, but they should be banned. These products are actually bioweapons, and they're dangerous. They're countermeasures to the official bioweapon, which was the virus, but they're toxic and they should be removed from the market. So the fact that they haven't that Marty McCarty, FDA commissioner, Bobby Kennedy, as the HHS secretary, Prasad as the vaccine committee guy. The fact that they haven't gotten these things off the market suggests that they're still to some extent beholden to what Peter McCullough, my wonderful friend and colleague, what he calls the biopharma complex.
Mhm.
Um, and so I just want to end on that note because it's it really should be it's time to kill the COVID mRNA injection program. It has to be done. This insanity has gone on for
Does
4 or 5 years,
does
and
it modify your DNA? I mean, just somebody who could actually answer that in an intelligent way. A layperson, you could almost wonder, modifying our DNA. I mean, to
yeah,
to the extremes of what's possible. I mean, to what extent? I've heard this discussed sometimes that this is still, it's sort of, it's still active in our body in that
yeah.
way.
I'll make a few points really quickly. One is that the illusion of safety was created because it's such an unstable technology that you get a great amount of variability in the composition of these mRNA vaccines. Okay. Some of them have a lot more synthetic mRNA than others. A very small fraction, like I think percentages between 4 and 8%, somewhere in there, have a lot of these so-called DNA impurities that are from the manufacturing process when they manufacture, and that 4 to 8% has been attributed to most of the morbidity and mortality, the serious morbidity and mortality that is associated. So you have a large segment of the population getting shots that are not causing problems. But then you get a certain percentage that are. So that creates the illusion of safety because somebody could say, well, my grandmother got it and she's fine, right? And so that's number one point to keep in mind. Number two is that there are these DNA contaminants that are introduced through the bacterial plasmid technology that's used in the manufacturing process for mass production. Okay. Most people don't realize that the original clinical trials didn't use this stuff. They used a purified form. So after the trials were granted the emergency use authorization, they used this mass manufacturing process that introduced all these DNA contamination. Okay. So it's a totally different product from what was approved in the initial clinical trials, and those trials are bogus anyway. But Then the third point is that yes, the integration does happen. We've documented, first of all, the persistence of the mRNA for 3.5 years, 3.5 years, persistence after a vaccination, at least. That's the minimum amount of time that has been documented. And it has been documented that the DNA contaminants do integrate into the genome of the human. Whether it happens all the time, we don't know. We
It
don't
sounds
know,
so
but we know
sci-fi. It sounds
it
so
is.
aligned with this kind of AI replacing, like altering our DNA. I mean, but
That,
we were told like, don't think like that. Like, so, and I don't necessarily, but just asking.
well, I mean,
Yeah.
you just opened a huge, I mean, we could talk about this for an hour. The different impurities that have been identified that are associated with these vaccines, like the graphene oxide, which is a magnetic particle, which is being attributed to, um, well, they're saying that it can pick up signals, electromagnetic signals, and that people could be programmed with this. So this is a very, very complicated discussion, but I would say that if anyone's interested in learning more, please check out my lessons learned paper that was published in the International Journal of Vaccine Theory, Practice, and Research. That's IJV as in Valentine, T as in Thomas, P as in Peter, r.com. Okay, and go to lessons learned. There's a big two-part paper where we talk about all these things in great detail. We also talk about censorship, how it happened, and how scientists were basically silenced, throughout the pandemic. And then the other papers I mentioned during the interview, the hybrid harms, which was published in Medical Research Archives, um, and then the myocarditis paper, which was published in the International Journal of Cardiovascular Research and Innovation.
Yeah.
So,
Yeah.
yeah, so those
Excellent.
are a lot to chew on. But if you want to look at the science, those papers really cover it all in great detail.
You're a real fount of information and perspective on these issues. It was surprising at the end there to veer into Mario and I have been following this bioweapons scholar, Jeffrey
Uh,
Kaye. I mean, he's a really amazing
hmm,
researcher, not quite mainstream because of his topics, but kind of a lifelong
hmm.
pioneer in some ways of digging that up. And actually, there's a lot of overlap. So we'd love to kind of touch base with you again soon when we're trying to focus on that in particular. So yeah,
Okay,
it's a real reality check, and a
okay.
lot, and also again, I will post some links because there's a lot more depth in your interview with all-time NBA assist leader John Stockton. You're able to get into the data in a way that I can't follow you, but I thought that was a
Hmm.
fascinating kind of tour through some of the ideology and narrative surrounding COVID. So thanks so much for your
Well,
generosity with your time.
you're very welcome, and there's still a lot we don't know. This is we're still uncovering more and more, especially about the DNA aspect. So, in that sense, it really was an uncontrolled experiment. That was your opening question. So I think it's an interesting time, and I think
Mhm.
the you're one of the things that you said that really resonated with me is you mentioned going back to 1932 and some of the things that happened around then. I really believe that all of this has been happening so that people could really wake up and break free from the shackles of what has been like a corporate socialist kind of system for a long time, and we need to find a way to get rid of that's why RFK, his voice has been so important, is getting rid of regulatory capture and getting free from all of these control mechanisms that have kept us programmed as a population for such a long time.
Hmm.
Yeah. So
Yeah, it'd be
thank you.
interesting. Yeah, like 2028, how much more, because I've been seeing just since we've been planning this call over recent months, there's clearly something moving in terms of understanding about yeah, this wider, not just the understanding of COVID, but like kind of, all the issues we touched on that intersect with it. So,
Yeah. Well,
all
thank
right.
you very
Well,
much, Patrick. I enjoyed it. Thank you.
all right. Sounds good, Nathaniel.